Okay, so when you have a Medigap plan, which is a Medicare supplement, most people today are picking either Plan G, Plan N, or a high deductible G. High deductible G is finally getting a little bit of press out there. So you have, in my opinion, got three choices. So when you're coming into this, it's a hard decision to make, right? Do you think of what your life is like today, health wise, or do you think of yourself in 5 years or 10 years and balancing prices and all that kind of stuff? So the obvious question for most people is then, hey, if I pick a high deductible G or a Plan N today, and then in 7 years, something changes and I feel like I just want a Plan G which has the most coverage. So if you're ranking them, Plan G is the top, the most comprehensive coverage other than the old Plan F. Okay, Plan G is the new most comprehensive thing you can buy for yourself. It just is. Plan N, middle of the road. Great long-term contract, but it doesn't have as much coverage as Plan G because you might have a copay or something. Not a big deal, but some people don't like Plan N for excess charges potentially hitting them. Not a big deal in my opinion either, but it could happen. Okay, and then there's high deductible G. High deductible has a $2,870 deductible, so some people are turned off immediately by that. So the question becomes, hey, can I change plans? If I just want to take this one for 4 years, can I change plans down the road? In most states, and I'm talking most states here, okay? I'm talking like Michigan, where I'm based, and the 22 states we work in. A couple of them have what we call a birthday rule, which allows you to change plans, like California. So in California, you can change, but you can only go in a certain direction. You can go from a G to an N. You can downgrade coverages. You cannot upgrade. All right, just about in every single state where there's a birthday rule, you can't upgrade, okay? Because think about that. The insurance company basically knows you want more coverage. Yes, you're willing to pay for it, but obviously your health is something's going on that you need more, so you're willing to pay more, so they're not going to let you do that. You can downgrade in most states. So again, trying to be generic here. However, in a state like Michigan, most insurance companies are going to require that you go through medical underwriting to go to a new plan. Even sometimes if it's the same insurance company, you might want to go from a G to an N, and they say, okay, you can be underwritten to see what happens, and we'll let you know. All right, so there's just no universal rule there. I would presume, in everybody's case, just assume you're going to go through medical underwriting. So try and make a good decision up front as much as you can. All right. I'm going to go through some underwriting questions because people do have a lot of questions about, okay, what does underwriting look like? What it just means is that agents like us will ask you questions. We're going to get you on the phone and just say, okay, let's see if you can go from this plan to this plan, this company from this company. Same thing. It could be same company, could be different companies, but you want to change from Mutual of Omaha to United Healthcare or the other way. We're going to say, okay, you want to go to Mutual of Omaha, let's grab the health questions and we'll ask you. So, hey, name, address, Medicare number, all that kind of stuff. And then you're going to have questions such as, and I will read from this kind of list, were you hospitalized as an inpatient in the past 90 days or 3 or more times in the past 2 years? Are you confined to a bed? Receiving home health care right now? Are you going through physical therapy? And I have to be really fast with this because there's about 25 questions per company. In the past 2 years, have you had any IV infusions or injections for primary immunodeficiency syndrome? Then it gets into things like, do you have end-stage renal disease in the past 5 years? Have you had leukemia, lymphoma, multiple myeloma? Last 3 years, any internal cancer, melanoma within the past year? Have you had any tests that you haven't had completed that your doctor says, hey, you need to have this done and you just haven't done it yet? So they don't like unfinished testing, right? Are you awaiting any diagnostic test results? In the past 5 years, have you been treated for, given prescriptions for pulmonary heart disease, heart failure, cardiac defibrillator, diabetes, only if you have retinopathy, neuropathy, things like that, kidney problems, ALS, MS, Alzheimer's disease, dementias, Parkinson's disease, anything related with bone marrow organ transplants? Past 2 years, any doctor, have you given advice, medical treatment, or prescribed medications? So a lot of times medications is the hang-up. For any of the following: artery blockage, had bypass surgery, stents, balloon angioplasty, heart attack, cardiomyopathy, enlarged heart, AFib. AFib's a big one, too. So if you see people with AFib, that sometimes is a no-go for lots of companies. Carotid artery disease, stroke, TIA, mini-stroke, hemophilia, osteoporosis, but only if you have injections for a fracture, spinal stenosis, quadriplegia, systematic lupus, bipolar disorder, schizophrenia, alcoholism and drug abuse, past 2 years, any blood transfusions, skin crack. You can, again, so that's kind of the end of this one, but I skipped over some. And then are you a smoker or non-smoker? A lot of states they're gonna ding you for being a smoker. So again, there's a whole bunch of, you can see that they're looking for significant things. So if you take a atorvastatin for some cholesterol, you're fine. You're going to get approved. But if you have a atorvastatin for some cholesterol and you had a stent put in 4 months ago, you're not going to get approved. All right. So that's what medical underwriting looks like. So again, in the beginning, try and start with what you think you might want and what you're okay with. Take the plan you're okay with today. All right. Be as proactive as you can, but just don't presume that you can just change plans. Don't forget that annual enrollment time in the fall, October 15th to December 7th, that's not going to save you. That doesn't mean you can go change and get whatever you want. You can't just do high deductible G right now and then say, I'm just going to change that in the fall. Okay. Also, know the insurance companies. Some, like Florida, I really like the high deductible G in Florida because you get the high deductible option. They just started this not too long ago, but it's pretty cheap, $60, $65 a month. You get the gym membership with it. And anytime in the first 2 years, you can just call United Healthcare and say, I want to change to the regular Plan G. So that's kind of a nice backdrop. And so there's states like that just have unique rules with high deductible G. High deductible G is not offered by every single company in every single state either. So you might have only 3 choices, and not every state operates the same. So lots to this stuff, obviously. Have any questions, post them away, email, lots of ways to get in touch with us, okay? And just try and, be as smart as you can about it, but just presume you're going through medical underwriting, okay? And this was long.